Hi, I'm Dr. Mache Seibel, editor of My Menopause magazine. At a recent meeting of the North American Menopause Society, I had a chance to interview Professor Mark Martins, and he's going to talk about why the test that comes back positive for STDs may not be positive at all. I'm speaking with Dr. Mark Martins, and he's got some important information for you. If your doctor says you have a sexually transmitted disease and you don't know how you could have gotten that, maybe I could ask you to share about some of the cultures and some of the things you were talking about.
Right, and cultures are the main reason we're talking about this. What I'm finding in my practice, and I practice infectious diseases in women, is that several women are coming to me, many women are coming to me and saying, you know, I'm sure that this can't be right, and I'm sure that this test where there's chlamydia, gonorrhea, and now syphilis can't be true, but I have a positive test result in my hand. How can it be? And I'm saying that tests have just changed recently in the past few years. It used to be you get a culture for gonorrhea and a culture for chlamydia and a different test for syphilis, and those tests would actually culture and grow the organism. So if this came from your body and it grew, it's really there and you really do have the disease. But now with automation, they're trying to find cheaper and cheaper and easier ways to do testing on a large scale. So what happens is it becomes a statistical analysis and not a culture. They're not culturing the organism. What they do is they use various assays, we call them immunoassays, or DNA probes to look for a small segment of DNA, and then they multiply them a millionfold, stick a little light on it, and then they get a number. And then they take those numbers and they say, the FDA says you have to be, if you want this test to be out there, you got to be accurate 95% of the time. And so the tests are pretty accurate. The problem is we study them in women and men at STD clinics, in clinics where they have a high prevalence of the disease, where they usually have it. So it's probably true they have it, not that it's an error, the 5% error in that test. However, if you're the average woman or the average man, and you get this test, and if it's 95% accurate, that means it's 5% inaccurate. And if the risk of if you having that disease is 5%, then when you get a positive, is it the 5% inaccuracy of the test or the 5% that you really have it? So 50% of the time, it's not right. And it's only because we're no longer culturing, and what we're doing is just using a statistical analysis to say it's likely for you to have this disease. So really what we're now getting is we're not getting cultures anymore for the actual disease. We're getting a likelihood and a risk of
So we're not getting
it.
the actual organism. We're getting a piece of DNA that could be in that organism and interpreting it as though you had the bacteria or whatever it is. If a person gets a sexually transmitted diagnosis based on one of these cultures, what would you recommend they do?
Well, first that you need to entertain the idea that maybe you do have a sexually transmitted disease, right, and seek treatment and make sure your partner gets treatment. But the other thing is if you don't think it's likely, you just need to ask your doctor and say, you know, what test did I get? And if it's a culture, then it's true. If it's anything else, then it's what we call a screening test, and ask them to confirm the test with a culture. Unfortunately, it's difficult to get cultures because everything's automated now, and they'll usually just do another screening test again and figure if both are wrong, you probably have it. But again, the word there is probably. Unless you get a culture, you don't know for sure. And I wouldn't ruin a marriage, throw a guy out of the house over a screening test.
So realize that a culture is diagnostic, but a screening test that measures DNA,
right,
that's typically in a bacteria that causes a problem.
But it's in other things too.
Maybe inaccurate.
Right. The tests are different because of how large the sequence or how small the sequence is. If the sequence is smaller, the sensitivity or the chance to pick it up is greater because you have more chances to pick it up. But if it's so small that it's also common with other problems or other that are non-STDs, then then you have a false positive. So there's a playoff with these different tests on which are sensitive to pick up enough and which are specific. And that's why there's different tests. And depending upon the laboratory and the cost of the test, they choose the one they want to do. But the main thing, as we mentioned before, if it's not a culture, it's just a statistical prediction that you have that disease. Unless you have a culture, you can't say for sure.
Thank you very much.
Yeah, you're welcome.